keeping the heartbeat of the city healthy with health tips and benefits from real doctors in the area. This is Health Help.
Good morning, I'm Dr. Stephen May and I'm from the Sullivan County Regional Health Department. And today we're here to talk about cold weather and risk and dangers associated with cold weather and cold exposure. Each year we have a number of people who die from cold weather exposure, particularly hypothermia and frostbite. We also have a number of people who die from carbon monoxide poisoning each season. So we thought we'd talk a little bit about that and then the preventive measures to prevent these types of injury during this cold weather season. Now, cold weather affects us in a number of ways, and a number of people in our population are definitely more sensitive to cold exposure than, say, a number of folks. So we look particularly for those people who are very, very young, infants in particular with cold exposure. They have a large area of skin surface where they can lose a lot of their heat, particularly through their heads. Those who are on certain types of medications are much more sensitive to cold exposure. So those who are diabetic, those who are on certain heart medications can be much more sensitive to cold exposure. So it becomes very important that we recognize those with high risk probabilities of getting complications from cold exposure, and we check on them often. That includes our elderly, those on many medications, and our young children when we have them out. Also, it's important that you dress in layers to prevent cold exposure. Certainly when the temperatures get down to certainly less than 10 degrees Fahrenheit, the risk of frostbite and hypothermia become even more important. Now you can develop hypothermia even as temperatures as warm as 45 to 50 degrees. If we get you wet and you lose a lot of heat, you can develop hypothermia. Now hypothermia is a condition where the core body temperature starts to fall. And during the first stages you start with extreme shivering, then you develop mental confusion, extreme cold shaking rigors. Then you develop mental confusion. You may actually want to take your clothes off. Even though the weather is very cold outside, you'll feel actually hot and paradoxically try to take your clothes off. Then after that you develop seizures, coma, and subsequently cardiac arrest and death. If you do find a person who is in hypothermic shock, the first thing you want to do is get them into a very warm environment and try to warm them up, placing warm packs either in the armpits and groin and around the neck, and reduce their cold exposure. If they have a cardiac arrest, it's important that you continue doing CPR till you get their core temperature warmed up. We've had individuals with cardiac arrest that's required prolonged cardiac resuscitation with hypothermia that have recovered fully and without a problem. So get them into a warm area, slowly try to get them rewarmed, and then get them into medical care, and certainly if they need CPR, get that started. The other condition that we see in winter weather is frostbite. Frostbite is a condition where you actually get superficial freezing of the tissues causing damage to the skin. Usually it's on the extremities, particularly toes, fingers, nose, and ears that are very subject to freeze exposure. Typically the skin will start becoming gray, may actually lose feeling. Initially it's painful and then it becomes very painless. And then the treatment for this is to warm the extremity slowly without rubbing. You don't want to use things that are extremely hot because they can actually burn the tissues and the individual not recognize it. So slow rewarming of the extremities, and then once you get the tissue rewarmed, then of course get it to a physician for him to evaluate what may need to be further treated. Once again, prevention is key, so multiple layers, covering the skin, protecting the areas that are most sensitive to frostbite, and of course maintaining that you keep your core temperature up. You want to certainly stay hydrated. Now one mistake some people make is to use lots of alcohol. They think it warms you up, but in reality it's opening up the vessels to the external skin, makes you think that you're warm when you're not. So alcohol both dehydrates you and will drop your core temperature even faster. So no alcohol, particularly during possible times of cold weather exposure. And remember that you can get hypothermia even in relatively warm temperatures. So 45 degrees or less, and if you get wet and soaked, you can become hypothermic. Please remember those who are at high risk. That includes the elderly, particularly the very young, for cold exposure. Another area that we worry about during cold weather season is carbon monoxide exposure. Carbon monoxide is a colorless, odorless gas that binds to our red blood cells and is the product of incomplete combustion inside particularly a home or closed space. With it, the people tend to become quote-unquote cherry red because the blood is extremely red with carbon monoxide, but it is not carrying the oxygen that you need. Subsequently to that, they become confused, may develop headaches, and then they can become unconscious and subsequently die from lack of oxygenation. They actually asphyxiate from the lack of oxygen. The only treatment for carbon monoxide poisoning is, one, removing from the source of carbon monoxide, and that can include space heaters, stoves, gas stoves, anything that is a form of combustion can create carbon monoxide. So remove them from the source, and then you want to supply 100% supplemental oxygen to revive them and certainly get them on the way to the hospital should they need further treatment. The other thing is preparation to go out into the cold is to prepare your vehicle. Never travel during winter season and snow on the ground. You want to be sure that you've got at least a half tank of gas. Should you become trapped and need to stay warm in your car, you usually run it for about 10 minutes, making sure that you keep the exhaust pipe well ventilated and snow from surrounding it. You also want to carry sand, shovel, flashlight, some type of heat source, certainly extra blankets. Don't come in your car when snow is on the ground prepared to go to work in an office environment. Be sure that you're wearing your long johns, your multiple layers of clothes, heavy boots or whatever in case you need to walk, extra salt, and then a way to communicate. Certainly remember your battery charger for your cell phone to let people know where you are, and have a cold weather plan should you become trapped in the cold environment.